Welcome back to American Medicine Today. So why don't you tell us, Dr. Bonati, what is spondyloarthritis?
Spondyloarthritis is an inflammatory process that affects the joints of the spine, primarily the sacroiliac joint and the facets. It's because in the past we called this problem ankylosing spondylitis. The ankylosing spondylitis is nothing more than a fusion that happened to the sacroiliac joint.
A natural fusion.
A natural fusion.
Okay.
But that fusion doesn't happen overnight. Take around 14 years
Right.
of pain before that fusion will occur. And when that happens, then the pain disappears. So fusion in that area is probably a situation that should be studied. This terminology was used before because what really happens is the diagnosis of spondyloarthritis is very difficult.
All right. Why is that?
It's because 80% of the population has back pain. And the main problem to diagnose spondyloarthritis is only 1.4% of the people has that problem. And the symptom or main symptom of spondyloarthritis is back pain. So the problem that we have is how you diagnose that. Well, the diagnosis is more a type of a study of the gene that is responsible of this problem.
Okay, so it's hereditary then.
Is hereditary, yes. Usually is familiar. So usually the family group has the problem and is passed to the kids. And the gene is being called the LA27.
Okay.
Now, this is a BLA27, the one that creates the problem. And usually it's associated with a small trauma or any type of infection that happened on the spine. There are two different types of ways to diagnose this disease.
And what are those?
The first one is radiographic type. So what you do is you look at the X-ray and you look at the sacroiliac joint and you see some type of a small damage on the bone. It's like a moth-eating type of a injury that you see on the bone.
All right.
That is the type 1. And it's more frequent in men. You have a type 2, and the type 2 is more frequent in women. And the diagnosis is not really very clearly observed with X-rays. So you need to have an MRI. The problem is the symptoms are equal. Is back pain, usually in the morning. When you get up the bed, you barely can move. Can be from slight type of a back pain to really a pain that you practically are immobile. And appears around when the people is around maybe 45 years old. The problem with that is confused. How you treat this. Usually the people go to the general medical physicians. The GPs are going to give you pain medication. They're going to give you some cortisone.
Okay.
And they're going to give you some anti-inflammatory, non-steroids, because this is something that is going to last for a long time. The pain usually lasts when you have an acute attack between 2-3 days to around 3 weeks. So it's really painful.
Okay.
But doesn't affect any other things. Doesn't affect the nerves. And the pain is back pain with hip pain and butt pain. So it's just all the back of the body structure is affected. And can be unilateral, can be bilateral.
Okay. Is this something where they would also try to send them to, what is it, a rheumatologist?
Well, usually when the GP gets this patient coming back and doesn't have any solution, if they think it's a rheumatological problem, they refer that to a rheumatologist or the neurologist.
Okay.
And then the patient ends in the hands of the neurosurgeons or orthopedic surgeons. But nothing can be done. 80% of the population who suffer doesn't have any relief. That thing comes and goes and comes and goes.
All right.
And not only affect the person, affect the family, affect the income, affect the relationships, and affect their job. Well, they need to be an answer. And at the Institute, we were working because we see people with this problem.
Correct.
And we are not doing any testing yet because I don't think it's necessary, it's expensive. And it's not going to tell me too much either. It's going to tell me, yes, this person is subjective to that type of inherited problem. And that's going to stop there. Well, that's going to cost a lot of money. And probably the insurance company, they are not going to do it. And probably the patient would not be very happy to pay a lot of money for something that they will tell them, yes, you do have a genetical problem, period. And you need to suffer the pain.
Is this something that can be treated with the Bonati spine procedures?
That is what I have few cases of this problem at the clinic. And we thought that there one area that the responsible pain is the dura. So we isolate that area and put some type of a soft support that area, not the bony structure or the ligament structure that is harder. And then we separate the dura for that contact. And to our surprise, the patients react very well. So it's a surgical procedure and it's a procedure that is successful. But because the population that we deal with is only 1.4, but 80% of the population has back pain, then it seems to be that this procedure will be able to control also the back pain. And if we can control the back pain, then the classical symptomatology of the spondyloarthritic problem will be solved.
Correct.
With the technique that we have, we correct the problem immediately, and the patients are satisfied with it.
All right. Well, to see if you're a candidate for the Bonati spine procedures, visit askbonati.com.